So good morning, everyone. Welcome to the Multnomah County Board of Commissioners Board Briefing. Today's meeting is held virtually, and due to construction at the Multnomah County Building, all Tuesday board briefings, Thursday regular board meetings, and proclamation ceremonies will be held virtually through the end of September. Please bear with us through any technical issues we may experience. For those presenting today, please turn your mic on when you begin speaking and off when you've completed your remarks. For all presenters, please state your name for the record before speaking or responding to questions. Our first briefing this morning is a work session to discuss revised draft Multnomah County Ambulance Service Plan. We have several presenters today. Before I turn it over to them, I just want to thank the EMS staff for joining the board for this discussion this morning. I want to recommit the intent and purpose of this work session and what I hope we all get out of today's discussion. So over the past year plus, we've had several briefings to keep this board and the public apprised of Multnomah County's work. First on the broader EMS system assessment, and then on how those findings, recommendations, and input translated into the key pillars of our EMS system that are part of an ambulance service plan. During our last board discussion on this topic in April, EMS walked the board through those recommendations and previewed how they would be reflected in a revised ambulance service plan. I know that this draft plan was shared with the board and the public in June, and appreciate that we've had some time to get familiar with it and hear from constituents and partners about it. Now we have this opportunity as a board to engage in a public discussion with one another and with the support of our EMS experts before our next milestone, which is an action of the board. I think it's important so that we can surface with one another the policy decisions we may want to consider or dig into further, well in advance of our actual vote to approve a new plan for 2028. I understand that many of our offices have had the opportunity to meet with EMS and ask questions, so I appreciate the time of the health department has spent with commissioners and staff ahead of this meeting. With that, I will hand things over to Erin Monig and Dr. Bruno to walk through some material and help ground us before we open up our discussion. Good morning.
Good morning, and thank you, Chair, and thank you, Commissioners, for the opportunity to talk with you this morning. I'm going to turn it over to Erin Monig, who's our EMS administrator, who's going to walk us through a few slides.
I just have a few slides. Good morning, Chair Vega Peterson and members of the Board of County Commissioners. I'm Erin Monig, EMS administrator, joined today by Health Officer Dr. Bruno. We're pleased to present the draft 2028 Multnomah County Ambulance Service Plan required by Oregon state statutes and rules. Our focus today is to support the board's discussion and answer questions that help us collectively establish the core service standards and shared clinical vision for our system that are fully compliant with all relevant state and federal laws and rules. Once we align on those baseline standards, the program will bring forward the corresponding updates to county code and administrative rule, as well as the required Section 7 selection process. Next slide, please. Over recent years, staffing shortages, rising call volume, shifting demographics, funding challenges, and regional system pressure have made it clear that our pre-hospital emergency medical infrastructure must evolve. Following an assessment process that included evaluation of all current data, performance, and stakeholder engagement, including assessing likely future changes in the system, in coordination with our industry expert consultants, healthcare strategists, this draft plan transitions Multnomah County away from a rigid, single-tiered deployment towards a dynamic, demand-matched response model. This framework provides complete operational flexibility across the full continuum of patient acuity. Today, we are here to discuss and answer questions about the draft ambulance service plan depicted in the gold on this slide. There are other documents supporting code, rules, contracts, and agreements that are downstream from today's discussion. Next slide, please. To establish these proposed standards, we underwent an extensive assessment and consultation process with key dates and actions of that assessment shown here. Next slide. Moving from report completion to public review and now further board engagement brings us together here today. Again, these are the actions that have happened up until today, showing today's date at the bottom of the slide. Next slide, please. And now looking ahead, following the added direction and our timeline to implementation following these key milestones. So today is an important step moving forward. Next step, next slide. We wish to acknowledge the valuable contributions from the Office of the COO and the Chair and the Commissioners and your staff, the EMS staff for strategic planning and drafting this plan, and all of the individuals and agencies who have provided their feedback to you and us. Under the unified clinical direction of our EMS medical director, this ambulance service plan provides a blueprint for a modern, resilient, and accountable EMS system. I welcome your discussion and feedback on these proposed service standards and look forward to our discussion today. And back to you, Chair.
All right, thank you so much for that overview. We'll open it up to the board for any questions for Aaron or Bruno. Thanks for walking us through this. Commissioner Moyer, any questions?
I think my question when reviewing this was, where does this line up with other jurisdictions? Since I saw some changes and I just was curious, does this align with expectations with our neighboring communities? Is this now a little bit out of alignment? I want to make sure we're still operating a top tier ambulance system.
I appreciate that question. And so again, our staff here want to align ourselves with a very high quality system operationally, clinically. And so this plan sets standards that are higher than the state minimum standards in many ways. It aligns with a tiered system, which our neighboring counties have also written into their most recent updates. We did a lot of cross-jurisdictional work looking at the geographic zones and how they match up at the county lines, and whether one of us is calling it urban and another suburban. Again, the state has set terminology that needs to be commonly used in all 36 counties across the state. And they are doing a rigid review to make sure that current plans are meeting those requirements. I think we may be on the front end of some of those reviews. We received some pretty direct feedback related to our geographic zones and terminology and to use the state definitions. And we looked at those with our neighbors. They're closely aligned. The time standards are different. Our neighbors, some of them are using the state required time, which is the response time stops when the first EMS provider arrives. Our standards use when the ambulance arrives. Again, our first responders are a value add to the system. They're not, they have their own ability to participate in the system as the jurisdiction wants them to. So we have a tough time holding them to a standard of going to calls or even responding in a certain time frame. And so there is some differences between us and our neighboring counties at how we do that measurement and accountability. The standards in this plan do meet or exceed all of those state minimum requirements and use state definitions, which means we should be in alignment with the other 36 counties within the state. And I hope that answers your question.
Yes, thank you.
All right, thank you, Commissioner Moyer. Commissioner Singleton, any questions for Bruno or Aaron?
Thank you, Chair, and good morning, y'all. Thank you for the presentation and always the conversations in leading up to this. I've just got a couple of questions. The response time standards on 23, Aaron, that's some of what you were just speaking to as we're using how we're measuring our standards there. And how is that going?
So again, moving from our current plan to our future plan or our proposed future plan, the definitions of the geographic zones is different. So our current plan recognizes an urban zone, which follows the land planning use of the urban growth boundary, which doesn't really indicate urban areas. We don't have a suburban zone currently. We have a rural area, and then we have a frontier area. So there are basically 3 proposed new additions to come in compliance with the state geography. And again, those aren't our definitions. Those are written into state statute. And then the times, the state measures the response time from the time of dispatch to the time the first EMS provider arrives. We think it's actually better for our community to measure until the ambulance arrives. We're able to hold them more accountable to that time standard. We also think that it is appropriate, given the difficulty getting across our jurisdiction with traffic and transportation and call volume densities, that those times are appropriate. Again, our assessment report recommended that we actually have a 12-minute response time across our entire jurisdiction. That is not compliant with state law. It would have increased all of the urban area and decreased some other areas, which would have added balance. But again, the state statute requires that urban areas be 8 minutes. And so we would have a longer standard than what the state allows. There may be a waiver process to do that if we wanted to elongate the urban response time. I don't know exactly what that would look like, but we deviated from the assessment recommendations and followed what the state recommended we put in there.
Great, thank you. In the plan itself, there is a comment about the EMS program office looking for ways to assist rural frontier search and rescue areas in the development and provision of training necessary to have an EMT. And I know that's just because of the volunteer nature. I'm curious if that is something that's already in practice or this is something we're gearing up to do. And if we're gearing up to do it, is there a resource need attached to it?
So since 1995, that has been in our previous plans that we assist rural agencies in meeting that minimum provider level. We have a good area of eastern Multnomah County that actually it has no fire protection district. It's outside in the Columbia River Gorge. And so Corbett Fire has an agreement to respond outside of that area. We heavily support the rural agencies, Sauvie Island, Corbett Fire, and actually Multnomah County Sheriff's Office is looking into potentially the provision of EMS first response as they have that desire to do some of that work, and they do a lot of search and rescue operations through the Sheriff's Office. So it exists. And then the county provides medical direction. So being involved in providing education and training that actually meets the needs of that medical direction, and our local protocol works very well in this community. It really ensures that there's a seamless handoff on patient care, regardless of what the agency is delivering that care. And we think that we highlighted that in the plan. Again, we're pretty agnostic to who provides the care. We need to hold an individual accountable. The accountable individual will be the ambulance provider to enter into agreements to supplement any staffing requirements. A lot of that will be in that draft section 7. We've been working pretty closely with our procurement team to make sure that we get an appropriate procurement process in place after we set these standards.
Wonderful, thank you. And then I just also really appreciate the continuous quality improvement. I know that's something that you're regularly looking at, and just appreciate its outline in here. I think my last question is around the complaint review process. Is there anything, what is different in this updated plan, or is it pretty consistent? And are there any particular complaints that we've seen that have then informed changes in this plan?
The complaint process is pretty consistent with current practice. Again, if agencies receive a complaint, they're to notify us for tracking of it. Sometimes complaints go to the state and then to the agency and us. So there are a lot of different doorways that those complaints come in. We get a range of complaints: professional standards, customer service, billing. We get a little bit of everything. And sometimes it's related, and we're involved, related to EMS. Some of our agencies provide multiple services: their fire, their first response, their public safety, and EMS is just a component of the service. And so when those complaints come in, we have to determine if we have a role in it or if it's a part of their other lines of service that they do. Again, we try and coordinate with all of the various professional standards bodies when it's appropriate to do that.
Thanks so much, Aaron. Really appreciate you and your work.
Thank you.
Had a little trouble coming off mute. Thank you, Commissioner Singleton. Commissioner Brim Edwards. Commissioner Brim Edwards, you're on mute right now.
Okay, sorry about that. I was going to say I would like to pass and let Commissioner Jones-Dickson go first. I have some questions around some of the comments that were submitted, but some of the comments were directly in his district, so they may be taken out. So I want to let him ask the questions about his lead off with that, and then if I could follow him, that would be great.
Great, appreciate that. All right, Commissioner Jones-Dickson, pass to you so that you could focus on any questions you might have specific to District 4.
Yeah, great. Thank you, Chair, and thank you, Commissioner Brim Edwards. Can you hear me okay? My headphones, I'm using new headphones this morning. All right, great. So just, I think we've first just want to say shout out to Renee and Aaron and team for just connecting with my office as far as the questions that we've been asking over the last couple months. We've reached out to the 2 fire departments, GPD, Gresham Fire Department, and then the Portland Fire Department. We spoke with both of their chiefs around just the ASP, just to get their feedback, and we received a letter from Administrator Lee as well. So I guess my first question or comment is in response to the letter that we received from the 4 smaller cities out here, specifically from Mayor Hyro, regarding the response times and how just the 15-minute response time and how we arrived at that decision within the ASP. I guess that's my first question.
We don't alter response times lightly, is the first thing. So we have a obligation under the state statutes and rules to meet their geographic designations. So we have to use those definitions. They're not ours. So we did that. And then through the assessment process, looking at traffic studies, looking at transportation studies, looking at current performance data, looking what the state recommendation is, we came to say that's an appropriate time standard. If you look at the maps from current geography to proposed future geography, a portion of the urban area gets put into the suburban zone based on the state definition, but a very large portion of the current rural area gets moved into the suburban zone. And so there's a movement on those times for specifically the 3 smaller e-cities, Fairview, Wood Village, and Troutdale. They move from 8 minutes to 15 minutes. Then there's a large portion of Corbett, the West Hill, out towards Sauvie Island that moves from a response time metric of 45 minutes down to 15 minutes. And so there's a balance there. And again, the assessment said 12 minutes would give you an equal time across your entire geography, and that would help push resources out further, and then they'd be responding in. We have a legal mandate related to the 8 minutes, and so without a balance, you get a very, very unattainable metric. I'm not pushing one metric over another. You asked how we came up to it. We think it's a metric that's achievable, that's safe for responders to be driving, that is responsible for the number of units that are going to be out on the road to do it. And over the last couple of years, we've had long discussions about that East County area is further from the 8-minute current metric. And there's a reason they're further from that metric. It's got a low volume of calls. It's got difficult traffic and transportation to navigate. There's no hospital in that area. And so, again, I think it's a proposed standard that is reasonable given all of the things we have to balance across the whole county.
Yeah, I hear you. Just between now and September, just our office would like to just convene a general conversation with the 3 city managers so we can all be on the same page as to how we arrived here and just what the options are moving forward. We might be bringing forward an amendment or of such. So thank you for that feedback. And then we also received 4 letters, like I said, from the Administrator Lee, and folks from BOIC as well. There's a lot there, so we would also like to set up a meeting just to talk through the concerns that concerns and recommendations that they brought forward as it pertains to just the fire department, how that, and just the overall EMS service here within the city. So there isn't a question at this time on behalf of regarding this, outside of just the request to bring everyone together to talk through the concerns and see how it shakes out in the final ASB plan come September.
I appreciate that, and I am happy to meet with them. A lot of the feedback we received was not specific necessarily to the ambulance service plan. Again, the ambulance service plan sets certain pieces, and then we still have the selection process, county code, administrative rules, and contracts. And
Right.
We received a significant amount of feedback that is related to those. Again, I would like to get draft documents of that done. If you look at our ambulance service plan, it is the foundation, and we can't really move forward with proposals to the other pieces if we're unsure about what that foundation looks like. So I look forward to engaging in those conversations and identifying where they live. So thank you.
Yeah, I appreciate that that clarity. That's helpful. And then the last thing that I wanted to bring, maybe this is a contract, the contract question, and it doesn't fit the ASP. One of the pieces of feedback that we got from like the fire departments, the frontline workers, we sat with Station 31 last week. They mentioned that there are times where they'll go and they'll respond to a call and they're using all their equipment, and it seems like they're doing a lot of the work, and they were talking about just payment for service. And I guess that would be a contract question. Is that right? And that has nothing to do with the actual ASP.
Yeah, I think we have a proposal in the selection process when we bring it to you to help do that. Again, we need to make sure that what we propose is going to meet the county needs, but also meet state and federal laws about allowable payments and not allowable payments through CMS. And again, I'm happy to go offline with you and talk through our concerns and issues related to that and how we can potentially address it moving forward.
Got it. And then my final question, does the current proposal or the proposal that we have before us right now, it states that we're going back to the 2 paramedic requirement. Is that correct? Or what's the difference between what we're doing now versus the than what's in the proposal?
I appreciate that very focused question.
Yeah.
There is a fundamental
It was highlighted.
shift. Yeah, it's highlighted. There is a fundamental shift. And so today's ambulance service plan. So if we don't approve a new plan, we don't move forward, we have the current plan that we have, it says that everything gets 2 paramedics on an ambulance. We're currently operating under a settlement agreement, and we're not following our ambulance service plan right now due to staffing shortages. The future plan, the future proposed plan, proposes a very explicit tiered system. Tiered meaning that we're going to send different kinds of resources to different kinds of calls. So low acuity calls, things that you think of as pretty minor, lacerations, falls, abrasions, things that might need stitches, going really far on the end, a stub toe or an earache. We may send no resource, or we may send a basic life support ambulance with only EMTs on it. A more general, higher acuity call might get an ambulance that has 1 paramedic on it. And then your critical call, the ones that we really think about when we're thinking about 911, your car accident, your multi-system trauma, your cardiac arrest, your heart attacks, your strokes, they're going to get an ambulance and then augmented with what we call an advanced care paramedic. That advanced care paramedic exists today in our system. Those are paramedics that have experience. They've worked in our system for more than a year. They're people that have been through our local county training. They've had specific training on difficult airway, intubation, low frequency, high risk procedures that you need for these high risk patients, high acuity patients. And so we're talking about having a smaller cadre of these advanced care paramedics focused on giving those high skill. You're not going to get one of those on every call. Right now, you're getting one of those on every 911 call. You're getting a lead paramedic. You're getting a paramedic from the fire department who's completed their field training and evaluation program that includes that county training. And what we're saying is in the future, that we need those on high acuity calls. The ambulance vendor, the vendor who's doing the work, should be accountable to ensuring there's one of those on scene. Regardless of what agency it comes from, they need to have an agreement for that to count towards meeting that standard or provide it themselves. And so there's no requirement that a fire department provide that advanced care paramedic. They could do it voluntarily, or they could enter into an agreement that may include compensation or something else to count for that. That advanced care paramedic, though, it's a part of the ambulance. They're going to have to ride in with patients that they perform those skills. And so, again, there's a conversation to be had between whoever's providing the ambulance services and the agencies that may have the ability to provide that component. That's not ours to tell them to do, but it is ours to make it allowable for them to enter into those agreements that can help move our system forward. So hopefully that answers the question about the staffing and how we kind of see those different levels and where the resources may come from.
It sounds like we came up with more options.
More options.
That sounds, yeah, that's great. Thank you. I don't have any further questions. Again, thank you for just taking everything that we've been asking for over the last 2 years, the feedback that you've heard from, sounds like from our current service provider, our fire departments, and thank you for the continued conversations between now and September. Had me worried for a second, but thank you.
Thank you, Commissioner Jones-Dickson. I will just say, and just so everybody's clear on the board, we're looking at the first reading right now. is on September 3rd. So just think about that timeline in terms of the discussions you want to have, the conversations you want to have, any updates, and we can continue to have the conversation if that, how that works for folks. But that's what we have right now. And then I think the second reading would be 2 weeks after that is what we're looking at. Okay, Commissioner Brim Edwards.
Thank you. I appreciate the information I received and sort of the ongoing over the last year updates we've received about the process. I did ask in response to feedback that I got from community partners about the level of consultation and engagement with our partners. And one of the things I think the response I got is like, we had all these, there were a number of public comment periods, and we also had some intentional engagement. My fundamental question is, when I look at all the materials that were submitted, and then the recent letter from the 4 cities, is it is one thing to receive public comment. It's quite another to understand whether the comment informed the final product. So one thing I'm going to ask for is, because the feedback I've got is that it hasn't actually informed the ultimate plan. And so I'm interested in sort of a detailed response going through, say, each of the items that were raised by the 4 Small Cities. We also have, a letter, for example, from the Portland Fire Battalion chief with very specific feedback about language and provisions in it. So the thing I would like to know is, as you go through all of their feedback, how was that incorporated into the plan? And if things weren't incorporated, which, I know that does happen, if things weren't incorporated, why not? Is it, for example, it's not going to go in the ambulance service plan, it's going to go in an ordinance, or it's in the contract? So I would like to see that. And then where are places that the county is just saying, we're not going to do that, or we're not going to make that change? It'd just be good to know, because I feel like it looks like our partners really came back with some thoughtful feedback, questions, concerns, and concerns about, and again, this may be the first stage of the process, but I would like to know before we vote on the ordinance on September 3rd, where we landed and why on those things. Like I say, it's part of the answer could be this is going to be in a different ordinance, or it's going to be in the contract. But because this is coming first, that's what I'd like to see. I'm also wondering, the 4 Small Cities asked for some benchmarking data to establish a baseline, and I'm curious, I would be interested to know whether that's something that you feel like you can do or are willing to do.
Happy to get you a summary of, I don't know whether we'll do line by line. Some of the information is repeated across multiple feedbacks, but we can get you where it lives, or what we did with it, or whether we recommended not including it so it didn't get included. So happy to follow up with you on the first item. And then the benchmarking data is sort of comparing the system we have today, which sends a hammer on every call, to a system that is more finite in the future. But we have current data. We provided all of that data to our consultants as part of the assessment process. We have clinical data and EMS quality improvement and quality assurance data going back to 2016. So again, multiple years. I think I was just looking at it this morning. something close to 1.5 million EMS responses were evaluated through this process to come up with movement forward. Again, release of the data in individual line level case information is problematic. We can go offline and talk about why it's problematic to release that individual level, but aggregate information. Again, I think we have a proposal that we should be releasing aggregate information.
Yeah, well, it sounds like we have lots of data. And having lived through my first 2 years on the commission with the response time issues, that I think it's a very reasonable request that we, and sounds like it wouldn't necessarily have to be in the ambulance service plan, but it's I think it's very reasonable to ask that we take all the data we have and have it be public, and we have a baseline so that we again know whether we're making progress or treading water, or falling behind, or whether we like something needs to evolve. But like without a baseline, it's very, I think it's hard for individuals who aren't actually running the ambulance service plan to know where we are. So I'll be interested. I'm assuming you got the letter from the 4 mayors.
Yes, I received it last night at the staff as I was leaving. But yes, we received it.
Okay, great. And the benefit of having something between having it now and not having a vote till later, we can, again, I'll be interested in sort of a point by point response. Then another issue that was raised, and again, we have lots of data, is just the disaggregation of data versus like system wide. And again, this is like somebody who represented a district that had some delayed response times. The importance of having disaggregated data, again, so we can see where places that are getting less, maybe less equitable treatment, or because of their specific geography or something else that being treated differently. I just want to sort of emphasize, I think, as a decision maker, that I would want to continue to see sort of disaggregated data so it's meaningful. So there has been a lot of focus also on response times, which, clearly when we had level zeros and didn't have ambulance available, that was very concerning. I'm curious on the other side of things, on sort of quality of care. Do you think the quality of care is going to improve, or this is just a framework that is sort of neutral towards quality of care, or are things in here that you think are safeguards or important foundational pieces for improved quality of care?
I love the question. We are moving from operational, easy to measure, to difficult, harder to measure. But over the last couple of years, while we've been working through this settlement agreement with basic life support ambulances and hybrid ambulances with 1 paramedic and ambulances with 2 paramedics, and the low frequency, high acuity skills and the number of calls required to stay proficient, we collectively think that the care in this community will increase because we will be sending the appropriate resource to the appropriate calls, giving people an appropriate amount of experience working within their scope of practice. Right now, our EMTs are sort of limited in what they can do because we're only using them on non-emergency calls, and so they're not getting experience for emergency calls. We have inexperienced paramedics that are running as leads, doing infrequent, low volume, high risk procedures that are better suited to people with experience doing those. So we think that this tiered system has research and studies that back that getting these right providers out will improve the outcomes of the patients, the thing that really matters. More patients surviving cardiac arrest, more patients having positive outcomes from trauma, the ability to deploy more low frequency procedures to a smaller group of people and ensuring that that's available to the whole community. So we think this recommendation actually does drive better outcomes for people in the community. And we need to measure it, and we need to get outcomes from the hospital. The hospitals have just recently turned on something called Health Data Exchange, where we're getting outcomes from the legacy hospital sent back to us to be able to match up with our care and triage. In an ideal world, all of our healthcare system partners would give that information to us and help drive better care for the whole community. It has been a battle and a fight, again, to get access to that outcome data. Really, the gold standard of measuring care in the community is, did your patient improve because of the things you do? So we're getting there. That lives within our quality improvement process. Again, looking at time-sensitive emergencies. Did we send the right care? Did we get them there quickly? Did we deliver the appropriate care in the appropriate timeframes and manner to get better outcomes? So we think that this plan, as written, does do that.
Great, thanks for that response. I hope More Than Legacy agrees to share that data because, again, that is sort of the other really important measurement aside from just response times. So then the other question, this is more, again, like where is the commission checkpoints? So we'll have the first reading on September 3rd. And I appreciate that I'd requested, instead of just 1 week between the first and second reading, that is be stretched to 2 weeks. So we actually can consider, because the reality is the first time the community can and our partners can come comment in a public setting, in a public meeting, frankly, will be, because there's no comment this morning, will be September 3rd. And if we want to be able to consider issues that are raised, a minimum of 2 weeks is necessary. Are there other, then the contract eventually, after an RFP or after the ASP is approved, eventually the contract will come to the commission to be approved, correct?
Yes, there are multiple steps. And so you'll have input based on how we're structuring the selection process as the county's procurement board. So it's not a straight RFP, it's not the recommendation. We'll be doing something that allows us a little bit more power to negotiate. So that'll come to you as the procurement board to get to weigh in there. There will be multiple steps. And again, the current contract with AMR as our provider under the current ambulance service plan goes through September 1, 2028. That feels like a long time, but it is not. We will need to be procuring services or whatever we're going to do 18 months before that end date. So there's a lot of work between now and March of next year in getting plans, code, rules, processes rolling in order to ensure that we are procuring services for this to be in place by September 1, 2028. So many more touch points.
Okay, and just to clarify, and I don't know if this is a question for you, Chair, but on September 3rd, the first reading will be on what specifically?
It's on this document. So it's a resolution that the board is accepting this ambulance service plan that we have as our part of our meeting materials, and that was shared in June. And then, and then we would have, so it's this plan and what's contained in this plan as our accepted ambulance service plan for the Multnomah County region. There's a first reading, there's a second reading. Once that second reading has been approved, then it is sent out to OHA, and OHA has to approve our plan before we can move forward.
Okay,
Yes.
if it's a resolution.
Aaron, wait, sorry. Aaron, go ahead. If I said something wrong.
No, I just want to add to that. So we've received feedback, and we are going to be recommending some edits and additions based on the feedback we have. Again, we've received feedback. We are trying to address some of the things that are coming in. So saying this plan, it is an ambulance service plan that would be coming in front of the board as a first reading to vote on. This first draft has revisions that need to come back to you. Again, we wanted to hear if there are any major structural changes or major components that we're only editing and drafting something to you as few times as possible before it comes to a reading. I understand there are amendments and things that can happen. We will get a updated version to you as soon after this meeting as possible. Again, we have some feedback on some things that just needed cleaned up, that are easy to do and meet people's needs about just descriptions and not mandates and different things that we received feedback on that we would like to address before you get to that reading.
So Aaron, can you just, make sure that we then get all those updates as soon as we can. And if you can make sure when you send them out, it's very clear like what has changed from the document that we have been looking at. That will be super helpful. And then I just wanted to clarify, I misspoke before. I think I said resolution. It's actually an ordinance, which is why we need 2 readings for it, because it's an ordinance to adopt the ambulance service plan into code.
Yeah, I was just going to ask that because normally with resolutions, we don't have 2 readings. So the ordinance is actually putting the ambulance service plan into our ordinance, into our code, or is it something else? Like what's the nature of the ordinance? Are we actually putting the ambulance service plan into ordinance, or are we?
I'm going to defer to Jenny, but the current ambulance service plan is ordinance 1238. So it is actually an ordinance, and we adopt and replace the existing ordinance with the new ordinance. It is a legal question, so I am going to turf it to legal to really answer, but I believe it's a replacement of existing ordinance.
But
it's the actual plan.
Yeah. But we'll let Jenny clarify, but just so it's clear, it is, we put it into our code as ambulance service plan, but it's will be suspended until it is actually fully approved. Okay, Jenny Madcore, please add your legal wisdom.
Thank you, Chair and Commissioners. Yeah, so the board's vote will be amending the ordinance, just as Mr. Monning said, and then incorporating the ambulance services plan into the ordinance.
Okay, and so say we have the first and second reading, it gets submitted. There's a possibility there might be changes, so we would change our ordinance, or no?
Yeah, so the plan that's ultimately adopted by the Board of County Commissioners will, if it's amended, will come back until we have all amendments read twice. So they're linked together.
Okay, this is I'm sorry, this is a process question, but it is one just again in my sort of taking things into consideration. So Aaron and Dr. Bruno, when we had our initial discussion about sort of how this was structured, it was like we're taking sort of the minimum standards and actually a little bit beyond the minimum standards someplace and putting them in the ambulance service plan. We're removing some things or leaving some things that are that maybe we might want to change just because if we have them in the ambulance service plan, if we have things in the ambulance service plan so above and beyond, and we want to change them and it's been approved, we don't have the flexibility. Is that sort of the short? We have less flexibility because you have to go through the whole changing the ambulance service plan.
Again, I appreciate the precise question here. So if the county changes our ambulance service plan, we have to go through with OHA, the approval process, and through a considering all offers procurement process. So items that are not strictly required in the ambulance service plan are going to be incorporated into county code. And so again, we will draft up county code, which will need to go through the approval process and vote on that. You can change the county code without having to go through the state's ambulance service plan review process. So things like committees or supplies or number of medical directors would be better served living in code, where the board could change it without changing the plan. So yes.
Yeah, this is what I wanted to get to, and I appreciate you going through, because if there are, for example, things that were like, we think this is an important element that should be as part of the county's I don't want to say ambulance service plan, but just like how we respond. However, we're not going to put it in the ambulance service plan ordinance language, because if we do, if we ever wanted to change it or we needed flexibility, there'd be a whole process to go through. But that doesn't mean we couldn't add some other things that are supplemental to the ambulance service plan in code, that aren't part of it, but that we might want to add that that also, so that it lives in code, not just in a contract or in sort of like we promise to do something, but actually we could put it in code, but as long as it's not part of the ambulance service plan code, we'd still have the flexibility to change it.
Yeah. As long, and the limitation is it cannot conflict with the ambulance service plan. It has to augment and support. So again, the ambulance service plan is our foundation to this house. The next step after building this foundation is to build the structure, which would be our county code, and then to put the walls up, which would be our contracts and agreements with the providers. And so, yeah, to your point, that's where it would be code.
Okay. Great. And then a question. One of the things, and that I'm curious also about, and just again to my earlier question about changes. So anything that's changed between what we reviewed this morning and what may be coming to us, I'd appreciate in a red line, not a like narrative summary, like we changed this in section, but like actually literally here's where we changed the words. So that's a request. And again, I very much want to see the crosswalk from the comments we had from our public partners to like where we landed. And again, I just think it's important, like issues are raised. It's very different to say like, hey, we solicited comment versus we considered it and here's like where we landed. In 2022 and 2023, the county was out of compliance with code, and that the Emergency Medical System Advisory Council had not been appointed. They were finally appointed, appointees were brought forward in December of 2024, and we appointed them. I'm curious, what role did they have, if any, in the development of this plan?
So they were involved in the assessment process. We convened a meeting, the consultants met with them. The consultants reviewed some of the assessment findings with that group. And so that's where they fit in with during the assessment process. That group was also a comment, or part of the assessment process was to reconfigure that committee. Again, I think we have a proposal at how to reconfigure that committee, appointing people and getting appropriate representation on an advisory committee is sometimes difficult, and create some, so it's not to remove them, it's just a different way of structuring them. So that I believe that lives best in code. Again, if committee structures change or committee needs change, it's easier to change it within code, and the board should be part of that discussion of what the purpose is, how they're going to fill it, how we're going to appoint people to it. It also gets to some of the points that we've received about governance and participation within the system. Again, we've received that pretty precisely from the small cities. Wood Village, Fairview, and Troutdale do not have a first response agency. So if a fire chief is representing them, it's actually a contractor. Gresham Fire is contracted for it. It's not the jurisdiction representing themselves. And so sometimes they're not in alignment. So again, I think we have some suggestions at how we may get different representation on some of the committees that we need and still achieve what we hope to achieve.
So that advisory committee, they were involved in the assessment, but they sent the, like, here's the draft plan.
They were.
And did they have any comments?
I did not receive any comments from anybody on that committee, individually or as an agent. No.
And is it, as just a follow-up after the meeting, can you send me who's currently on that committee?
Yes.
Again, this was like quite an issue in 2022 and 2023. So my last question, again, this will be sort of want to have some answers between now and September, is in the plan there as a system in which multiple jurisdictions have a role in the response. There are some, I think, there are dependencies that are indicated with the local fire departments. And I am wondering if you took into consideration the fluctuation that there may be in funding for the fire departments. So, for example, we just saw, and I'll just speak to the city of Portland, we last saw in the most recent budget cycle, potentially closing the North Portland station, getting rid of some of the smaller rescue units in East Portland. So is this plan built on, we're counting on the fire departments to have, X level and the fire district 10 to have this level of service, and the plan's success is dependent upon the current level of service? Or is it, or have you made allowances for there could be, significant reductions in fire departments' level of services or what they're able to do in partnership?
We have taken into account another good question and some of the feedback we received. So what is written into the ambulance service plan is a description of the current services they offer. We're actually going to propose putting current in front of everything. There is no mandate in there that the fire department do anything. They participate at the level that their jurisdictions fund them and support them to do that. Again, we think there are some ways to partner regarding future funding agreements. There's no mandate in there for that. Before my time in 2010, we received notice from Portland Fire and Gresham Fire at that time that they were going to exit EMS altogether due to financial constraints. So I am quite familiar with getting notices that people may leave the business, and we can't count on them for that. So it takes into account getting the right number of providers, the right type of providers, and having those jurisdictions provide levels of service down to no level of service, although there's no time that the fire department will not be interacting with EMS, even if they were not providing medical care. They provide fire suppression and rescue services, including extrication as part of their fire duties. I previously worked in a system where the fire department provided no medical care. So I do know that there are systems in the country that operate under that model. It is not ideal. It does not get all of the patient care as fast as this community is used to. And funding could change. That could be our reality. So this plan recognizes that that could happen. Again, we want to support the fire agencies, city jurisdictions to participate in the system at whatever level they can, whether that's the high level that they currently participate at with paramedics providing advanced level life support care on scene, or whether that's just providing the fire and rescue services. Again, I think there's a range that could exist over time, given all of the funding challenges we have, both in municipal, county, and healthcare reimbursement. So it recognizes that change or potential change.
Great, thank you. All right, I think that's all my questions. This is my last comment. I want to say that I appreciate the joint letter also from AMR and Teamsters with their comments and their work with the county team on this. And I guess I look forward to in the next month hearing really how we're engaging the partners who still have significant concerns about the draft and how we land those in a way that ultimately, delivers great care and service to county residents in every corner of the county.
Okay, thank you, Commissioner. So I really appreciate all of the questions. I think this is exactly what we wanted from this work session, to make sure that we were raising issues, that we had a really good understanding of what is in the plan, how the plan came to be, what we're going to be voting on, and then also the opportunities for the board to shape how ambulance response looks in the county outside of the plan, with the work through the ordinance and the contract itself, because I think that's a really important distinction. So I want to thank Bruno and Aaron and all of the folks, including so many people who are in our first responder community and our neighboring jurisdictions who engaged in this process and who have provided feedback on this. I think one of the things that I'm really happy to see in the ambulance service plan is this additional flexibility in terms of how we're able to have a plan that really shapes what our expectations are, what this service would look like, but also gives flexibility in terms of changes in situation that we have experienced under our current plan. I had one thing that I wanted you to just go into a little bit more detail, because I also think that it's a good improved change in the ambulance service plan that's being proposed. And can you talk a little bit about the difference in how subcontracting is handled in this ambulance service plan versus our current one?
So I'm going to go back to the beginning. So subcontracting is permissive. And so in 1995, the plan prohibited any subcontracting of services. In our 2016 revision, we permitted limited subcontracting. And again, this, I think, moves that forward. We don't want a provider, the awardee of the ambulance service area, to subcontract the entire county. Like, that's not the intent of the county, to award it to somebody and have them administer it. The intent is that they could contract with other entities and to help get those services. we've had a big push related to not enough staffing, and again, executing a staffing contract that helps achieve the metrics is helpful. Contracting with fire agencies for first response or personnel that help meet those is encouraged. Again, we want those relationships to occur, and that happens through the franchising contracting process, not in this ambulance service process. But I think we've really moved to a process where we're not just saying you can do it, we're promoting you to do it, actively pushing you to have those relationships, financial, operational, to make it more of an integrated system. And again, that helps fix some of the issues related to interoperability, some of the feedback we got related to finance. And so there's a push in this one to really expand what that looks like.
All right, thanks. I appreciate that. And I think that was an important thing to tease out. So yeah, so I appreciate the conversation. I think a lot of Commissioner Brim Edwards' questions around like what's in the plan, what's not, how this will look moving forward for the board is really important. So please, I'm encouraging everyone on the board to take another look at the plan, especially once Aaron sends out the information about the updates that are already been made, and get those so that we can move forward in September with something that really feels like it represents what we want to see and have this plan going forward. Commissioner Brim Edwards.
Yeah, I was for me, it'll be important to also see, in addition to that red line, to see kind of where you landed, in what way, how the feedback that we got, especially from our systems partners, and the small cities, like where we landed. So, getting that on the front end, so there's time to have like discussion, to ask questions like, how come you landed there? Or, share more like where this actually is if it's not in the ambulance service plan. That would just be helpful, because I think in some of the communications back and forth between the health department, it's been like, hey, we gave it to the commission, last year. It's like, well, we're just now getting, I think, visibility to some very specific feedback. So, understanding how that's been incorporated or not, and the reasons for not incorporating it are going to be, for me, going to be important before we get to that final stage.
Great. Thank you for clarifying that. I know you had mentioned that a little bit earlier too. So we'll, I think, and I know that Aaron and team are happy to continue to meet with offices before we get to the September date. So I just want to thank you again, Aaron and Bruno. I want to thank Renee Hunzinger in my office for all of the work that she has done on shepherding this for years now, and continue to work. So thanks, everyone. We are going to move on to our next briefing. We have 2 more today. So our next briefing is a deflection program briefing. So we'll move on to that. Thanks again. But we're staying with the health department, just moving to a different section. This briefing is going to provide an update on the implementation of the board's resolution from February and early insights on what the program is seeing in the 90-day model. So we have Anthony Jordan and Natalie Amar from our health department here. Hi, Natalie.
How you doing, Chair? Good morning, Chair and Commissioners. My name is Anthony Jordan. I'm the Interim Director of the Behavioral Health Division, and I'm presenting today with Natalie Amar, the Division Work Out of Class Policy and Program Liaison. Next slide. So we have 2 parts, two-part focus of today's presentation. The first is to update the board on the implementation of Resolution 2026-012, and the second is to share with you our early data from the first month of the programming under the new deflection criteria that took effect on January 5th, 2026. Next slide. This past February, the board approved Resolution 2026-012, establishing policies for the House Bill 4002 deflection program. The public can access the full resolution through this image link on this slide. In July, as part of the regular reporting and change request cycle for our deflection program grant, we submitted a request to the Criminal Justice Commission for approval of the new successful completion criteria in the resolution. Also, the full resolution was provided as part of our submission. For context, as we talk about today's implementation, it's worth noting that some of the resolution components could be implemented immediately, while some requires action over longer term and other system partners outside of the deflection program. Next slide, and I will now turn it over to Natalie.
Natalie, it looks like your audio isn't working. Now you're on mute.
Okay. Do you hear me now?
Yes, thank you.
Okay, I apologize for that. Thank you for letting me know. I'll start over then. Good morning, Chair. Good morning, Commissioners. For the record, my name is Natalie Amar. With Anthony's last point in mind, I just want to take a moment to frame how we will talk about implementation in this presentation. I'll refer to the contents of the resolution as falling into one of two categories. The first will be key components of deflection, and these are defined as anything directly related to referral pathways, eligibility criteria, and successful completion criteria. The second, we're calling broader considerations. These are defined as any provisions beyond the key components that require, for example, research or further inquiry, or that touch on broader system-wide considerations that might intersect with deflection. They might also require action by other system partners. Next slide, please. Next slide, please. Thank you. This slide is showing that even before we took the final step that Anthony mentioned in July of seeking CJC approval for an important aspect of the successful criteria change, we had already begun implementing other elements of the resolution that did not require that approval. We also implemented all the changes directly required by the district attorney and the leadership team, which started in January. Next slide, please. So in this next part of the presentation, I'm going to cover specifically those provisions of the resolution related to that first category that I framed. Next slide, please. The next few slides include tables like the one that you're seeing here that were excerpted from a document that we shared with this board on May 21st. That document provided insight into the implementation status of the resolution we're discussing today. Because the resolution is comprehensive, we categorized the various provisions into what we refer to as topics. Those topics are shown in the left-hand column of the slide. The center column includes citations to specific sections of the resolution, and the column on the far right indicates where we are in the implementation process. So as you can see here, all of the provisions on this first slide, which relate to those key components of deflection, have been implemented. These include, for example, the changes to the length of engagement, moving from 30 days to 90 days, the requirement that individuals complete either 5 follow-up visits with care coordination or meaningfully engage in a SUD service within that 90-day period, and the new consequence that a warrant would be issued for individuals who do not successfully complete. The last row on the table lists the leadership team as the topic. The specific provisions referenced there relate to exploring expansion, deflection eligibility, which is ongoing with the leadership team and with the DA in particular. Next slide, please. So now I'm going to cover those provisions that are related to what we're calling broader considerations. Next slide. Again, this table shows each topic from the resolution on the left, and then you have the citation in the middle column and implementation status on the right. As you will see here, there are several implementation status tags. It's important to note that just because a topic is not marked as implemented does not mean that implementation has not started. I also want to note that in the version that we provided to the board on May 21st, the label for section 6, 6B, and 6C was originally named out of deflection scope. We revised that label for this presentation to acknowledge ongoing efforts within the county as relates to these topics that we're plugging into. So in some instances, you can see that the engagement of partners has begun, or there are countywide efforts underway. There are also efforts that we have started and partially completed, but that still need continuous effort over time. For example, that is the case for Section 4C. The program has already obtained access to HSD's priority list for coordinated access. Deflection care coordinators are trained and currently using both WellSky and the MIST. For example, however, our programs work with providers to strengthen service connections, and case management will, of course, continue beyond what we've already done. And of course, we're always looking to improve ways to make those connections. Similarly, with respect to transportation, we have already implemented significant expansions through our new operator contract. The operator is now able to support police missions, so transporting for police as part of their mission activities, and to have outreach workers present at those missions. And we're also actively working with our law enforcement partners in deflection to expand options beyond the mission context. At this time, we're also continuing and will over time continue to explore leveraging partner connections and capabilities to bring even more transportation online into the center and also out to services. Next slide, please. And this is the final slide referencing the specific provisions and implementation status. So related to those provisions covering data systems, we have, as part of the shift in programming, updated our data systems and put in place new processes, including with the district attorney's office, to track and share essential metrics. In fact, I'd like to take this opportunity to appreciate the excellent collaboration from the district attorney and from his staff to ensure that we are sharing the right data, identifying related issues in a timely manner, and for partnering with us continuously to make improvements as we go. We've also updated our reporting. Beyond that, we're continuing conversations with our data partners, with our evaluation working group, and with the CJC to identify the best ways to access the data we need to inform program improvements. And I'll also add that when we've put in place processes to keep this board updated through briefings and other information sharing to improve coordination between this board and the leadership team, including through a charter that the leadership team will be reviewing and adopting. Next slide, please. So now we're going to move on to the data portion of the presentation. Next slide. So this chart is our key metrics snapshot. It's covering Q3 of FY26. And before diving into the tables, I'd just like to recap our major programmatic changes because, of course, that changes what our data looks like. So a referral to deflection now also results in a case referral to the DA. We've shifted from a 90-day deflection window, from a 30-day deflection window to a 90-day deflection window. We have changed the successful completion criteria in alignment with this resolution, which requires individuals to have at least 5 follow-up visits with care coordination or to meaningfully engage in a SUD-specific service within the 90-day window. I also want to emphasize before we go into the numbers that the data you're seeing really is preliminary. It's a very small data set, and that data will need time to mature. This is in large part due to that 90-day window. It's a lot longer, so it takes us more time to get information about each particular individual that comes through the program. So it's going to be really important that we don't assume at this stage that what we're seeing in the early data will continue. We need to really just allow more time to pass before we can see what the trends are telling us. So let's get into the slide. There's three primary takeaways from this that I want to highlight. The first is that the engagement rates are substantially higher than they were in this period last year. And by the way, we've included in the gray column the same period from last year, just to give some context to the numbers that we're seeing. Of course, understanding that that the program looked really different at that time, but it's just a reference point. Also, our completion rates are up from the same period last year. And the services that were accessed by those who completed were SUD specific. Remember, that is an important change that has taken effect this year. And nearly everyone that has successfully completed has done so both through follow-up visits with care coordinators that are at the Pathway Center and also through meaningful engagement with a SUD-specific service. Next slide, please. And so this is just a graphic representation of what I just presented in the previous slide. So essentially you can, as you move from left to right, you're kind of walking through the process with the individuals from the moment that they show up at the center and the moment that their determination of successful completion is made. So you can see how many engaged. We had 21 who did, 2 who did not. You can see the number of people who successfully completed and what they did to successfully complete over there on the far right. Again, this snapshot is of early data, but it is promising. So if these trends do continuing, this would be positive. This would be a positive development and could be indicating to us that the program shifts really are achieving the desired outcomes of those policies. So again, it's early, but it's certainly showing some positive signs. Next slide, please. And of course, we wanted to share with this board a client story that really puts the numbers that you all just had a chance to look at into perspective, right? Because we're not talking about numbers, we're talking about people. And so this story is really about a particular experience of one of the folks who came through the program. The individual was referred by law enforcement. The individual received the services immediately upon arrival at the center. That includes the screenings that we do, medical and for SUD. The individual actively engaged with their care coordinators to be a participant in the development of their care plan, seeking specific treatment services, and was able, through a subsequent follow-up visit, returning to the center, to actually also then be connected to shelter services in that subsequent visit. So this is really an example of the kind of comprehensive engagement that we want to have with folks that come through the center, right? Each time somebody comes back, each time there's a second or third or fourth engagement, there's a chance to provide a little bit more support to each of these clients, many of whom have multiple intersecting needs. And then in the second part of this client story, that second paragraph, we're really describing here the process that our care coordination team over at the center follows to engage with the providers that are working with the clients in other services, right, out in the community, how we verify, and then how we coordinate with the district attorney to share information about each particular client's outcomes. Next slide, please. So in summary, what you heard today is that the key components of the resolution have been implemented, and the other components really are moving towards full implementation or in process. The data that we're seeing from the early months of programming under the new deflection criteria and our new program shifts are really promising, albeit preliminary. We really greatly appreciate your time and support as we continue to grow this program and look forward to keeping you updated. Thank you.
Thank you, Natalie and Anthony, for the update on everything that's going on. It's great to have this data and all this information. We'll go to the board to see what questions there are for you, and we'll start with Commissioner Singleton.
Thank you, Chair. Good morning, all. Thank you for these updates. On May 21st, we received an email that had a more thorough update on the resolution and what has been implemented or not. Is that something you all can send us as follow-up to this conversation? That the slides seem to be a snapshot, but maybe not every component of the original resolution.
Yes, I think we can do that, Commissioner. Yes.
Thank you. And I think it will be no surprise to you all that one piece in particular around the sheltering says it's implemented, but it also refers to people having access to a wait list, which is not quite the same. So I'd love to just follow up with you all because the behavioral health shelter in particular, referrals are controlled by the health department. And so there should be a better way to streamline that and get people into that behavioral health enhanced sheltering. On the data piece, have we done any conversations with frontline law enforcement, and just are there any updates? I see the referral numbers, but curious, I know it's been kind of up and down and folks feeling like maybe they weren't necessarily seeing some of the changes they wanted to see. So just curious where we're at and how the rank and file are feeling about the updates and if we're seeing referrals pretty consistently increase, because I know the data that you shared ends in March.
Yes, thank you, Commissioner, for that question. We have been, since the rollout of the new program, really working with law enforcement to help to ensure that there's education around the program shifts from within law enforcement agencies, and we've been really making attempts to support missions and other efforts. So we've been really putting in a lot of effort to communicate and be a resource for our law enforcement partners, and they've been taking us up on that. Referrals remain a challenge. So we have, while we're seeing a lot of shifts in terms of kind of the engagement levels and the completion and those metrics, the metric that has remained consistent really has been around referrals. There's a limit to what we're able to do as a program to raise that number, but what we have been attempting to do is to support law enforcement missions, as I mentioned earlier, by providing assistance through outreach workers and through assistance with transport during those missions. That came online in July with the change in the provider. So when our new provider took over, we were able to begin implementing those changes. So it's still early to tell what the impact will be of those changes, but those are the ones that are within the program's control and that we're trying to really leverage. I think I can tell you anecdotally from my own interaction with the officers that I've been able to engage with through those communications and education efforts about what our program is doing, that the responses have been positive around the changes. I think these do have the potential to increase officer buy-in, which for all deflection programs is really a critical piece, right? These are our referral partners. But again, what that will translate into in terms of referrals is still an open question.
Thank you. And over time, will you be able to share disaggregated data on referral source so that we understand where maybe we need to do some more work and where we may be getting a lot more referrals from, just so we can understand that fuller system?
Yes, Commissioner. So I just want to be clear that our current policy and the model that we have is a law enforcement intervention model. So right now, law enforcement is the only official source of referrals into the program. So we can certainly disaggregate by specific law enforcement agency, but that will not show anything else, right? It's only going to show by what agency, how many referrals were coming in. And we can certainly do that, but it's all going to be really still those law enforcement referral pathways.
I'm sorry, I'm confused there then, because we had talked about, and I've heard updates from you all that outreach providers and peers were being integrated into being able to refer. And are you also calling Portland Street Response a law enforcement referral? Because my understanding was they also could refer in.
Yes, let me clarify that Commissioner. So we have pilots, and we will be providing updates on the pilot numbers, but the official deflection numbers, so the ones that we report to the CJC, the ones that are in line with our grant obligations, those are still based on the law enforcement intervention pathway. We are doing many other things. So you are absolutely correct that we are trying to understand how outreach could change what we're seeing if we were to shift in that direction, if that's how the policy ends up changing. However, because of our obligations to the funder, because of what we're committed to in our grant, we still are reporting only on the official pathway numbers. We certainly can provide data on all of the other things that we're doing, but I just want to be very clear that those are not the official way into deflection for our county at this time.
So the data that we had in front of us today is just law enforcement data.
That is correct. Yes.
Okay, can you please send us follow-up the fuller data that includes the pilots? Again, I'm not sure how we're supposed to understand the policy pieces if we're not seeing that data. And I would ask that regularly, even if it's just labeled that it's different or it's a pilot, that we get that full update when we're talking about the deflection program.
We could do that, yes.
Thank you. That's all for me now, Chair. Thank you.
Thank you, Commissioner Singleton. Commissioner Brim Edwards.
Thanks for the presentation and also for the briefing earlier this summer based on many of the questions that I have had over the last 6 months. And I am look at the data as promising. It appears, and again, we need to wait, and we need actually, and also like greater numbers because the numbers right now are relatively small. But that when we raise the expectation and the level of support, that people rose to the new success criteria. And we also gave them, I think, a much more reasonable amount of time to actually engage in treatment-related services. So the 90 days versus 30. Again, I'll think this is the new data is promising. Again, it's a relatively small number. One of the things, and this is, you won't be surprised because I raised this in our meeting, I think we really need a concrete plan of how to increase referrals in. The county has made a very significant investment in the deflection center, and it may be that when we get this additional like non-law enforcement data, the return on investment will look better, but there'd have to be a whole lot more outside of it. So I do think having the consolidated data would be helpful. I also, and I think this is a request to the chair, is that a plan be brought back with a here's how we are going to better utilize the resources that we have at the deflection center. Again, we know there's a lot of need. It's not that there's less need, but there's a significant need. So how do we better utilize not just the treatment-related services, but the other services that are in existence? So I'd love to see a plan come back to us to be really deliberate, because I do feel like we have been talking, there's been a lot of discussion over the last year of like, we're talking to Portland Street Response and all these, working with law enforcement to increase referrals. And yet we're not, the data seems like they've gotten a little bit more, but not substantially more. So I'd love to see, again, a very specific plan about how we think we can more effectively utilize what is a great resource. So that's a request. And this is a follow-up from Commissioner Singleton's question. Is the non-law enforcement data that is not presented here, is it gonna change the numbers substantially, or is it just like a marginal difference?
Thank you for the question, Commissioner. I don't think it's going to, so I think the two pilots that we have, where we have, the small pilots with Portland Street Response with one of our community partners, I don't think they will substantially change the number of referrals into deflection. So I don't think it's going to show a massive shift in the numbers, but I think it is important to recognize that some of our efforts are also, as you referenced, they're intended to use the resources that the county has committed to helping members in the community that would benefit from those resources. So the numbers that you're seeing are about deflection, but when we now are able through our provider to send outreach teams out into the community, they can bring folks into sobering, which is also at the center. And of course, that we do provide updates to this board about our sobering utilization on a regular basis. And that's another part of what's happening at the center. As you know, from the change in the criteria that we have, even the people that are deflected, now they're coming back. So we've increased, let's just use the word utilization as a shorthand here. We've increased the engagement opportunities for those folks that are coming in by opening that door. We're continuing to work with community partners. So even if it's not deflection, the utilization of the resource is increasing, and we can certainly come up with ways to report back to you on what that looks like as it continues to evolve and as we continue to find new ways to make sure that we're providing things to the community that needs those services. Also, of course, as we go to the permanent center, the scope of what we're going to be able to offer really does increase. And so by the time that's all in place in 2027, this will look really quite different. And the advantage that we would have is that we would have established a lot of the relationships and the processes to be able to, and also data and things that we're looking for. We'd have a good sense of what those are, and we'd be in a position to get those out quickly once the permanent facility is open.
Yeah. So I would really encourage that we have, so there is sort of, I think, like the baseline data for deflection, but I do think it's absolutely critical that we have a consolidated sort of report about how the services at the facility are being utilized, because when community members see data that implies like one person a day is there for, both a facility and staff, it gives the impression that we are not fully utilizing it. So I think it would be helpful not just for the commission, but also for the broader community of like, how are we most effectively utilizing our resources? Because everybody knows by just living here in Portland that there's still a huge need. So that would be helpful. And again, I would ask just the chair to come back with a plan about how we're going to continue to increase the utilization, and Natalie, and using your term, the utilization of the whole facility, not just for deflection. So that would be a request that I would have. I also want to thank staff for submitting the Commission's definition of success to CJC for approval, because this was a subject of debate. So thank you for submitting that. I appreciate that. And I just, for the record, as I close out, just want to note that on slide 5, and this is not a criticism of staff, but on slide 5, it has implementation timeline, and it goes back to November, December, and January, and it's all about the leadership team and the DA. And it does not at all represent the fact that the commission had several work sessions. We committed to a reset. I mean, the only mention of like the commission is on February 26th. But the reality is in November and December, the commission was very clear that we were going to bring forward, and Commissioner Singleton and I committed to this, that we're going to bring forward a resolution to reset the success criteria. And I don't want the record to just imply that somehow the commission just was sitting out there not doing anything. And this was all driven by the leadership team, which of course doesn't meet in public, and the DA. When the reality is, we had work sessions. We were very clear we were going to bring something forward. So I just want to note that for the record. And again, this isn't a criticism at all of staff, but I want the record to be clear that the commission had said we were going to change, lead a public-facing process, which we did, of resetting the success criteria and also being clear about the integration of other services. And that's all I've got.
Thank you, Commissioner. Commissioner Jones-Dickson.
Yeah, thank you, Chair. And just wanted to echo some of the things that have been stated already. And first, just thank you. Thank you both for being here and for all your work over the last 2 years. It's been a huge eye opener for sure. And I just wanted to build off of just to double down on what Commissioner Singleton mentioned, just having the data as far as the pilot programs. I know we're piloting a program out here in East County just to see the numbers and the overall impact. Definitely curious. This is outside of what you presented, just the shift in our providers and the level, just the difference, if any, as far as the level of care. And then lastly, again, just a deep appreciation to Chief Brown, because he took initiative post the conversations back in November to work with you all as far as coming up with the adjustments with the CJC and everything like that. And then also thank you for humbly taking our feedback and presenting that to the CJC as well. So a whole bunch of gold stars. I don't have any other feedback outside of what Commissioner Brim-Edwards and Singleton has mentioned as far as the information that we've requested. So thank you.
Thank you, Commissioner. Commissioner Moyer.
Yeah, I echo my colleagues on looking at the totality of the center for our purposes. And then, I have had the pleasure of talking with you guys often about this and then the future center. And so, I'm very interested in where people end up after the 90 days and if they stay engaged with us for however long, however long we can track them and they're engaging with us, what that leads to. I'm also very interested in knowing the services that they engage with, just to get a sense as we get more people in and learn how to navigate people through the system. I mean, I haven't hid that my hope is that yes, we will run a deflection program, but we will run a front door for anyone, and that we will be actively working to remove barriers to somebody's long-term recovery. And so just anything going in to planning for the new center, and as we build what are we going to track, things that will help us do constant system improvement, but also oh wow, we've got a gap right here. This seems to be a challenge we're seeing with lots of people. It would be really helpful feedback for the system as a whole. So I'm excited about this. I think I always want deflection to be successful, but I don't want somebody to have to engage with law enforcement to get the help they need. And so I'm glad that we are doing both, and really excited for what the future holds with this work.
Thank you, Commissioner. So really appreciate the conversation. Thank you, Natalie and Anthony, for the presentation today. I think a couple of things I would say is I do, and I appreciate that this was an update on deflection specifically. However, you've heard today, and I think all of us share this really desire to see the more of a holistic picture of how things are going at the Pathway Center, what that usage looks like, all of the different ways that that services are being provided, connections are being made, whether it's the deflection side, the sobering side. So we have a sense of what the work looks like, especially because we do have a new provider there too. And I think that's important to hear how things are going with that new provider. And I think it's especially important as we're looking forward to the permanent center being opened, and the fact that deflection is going to become a smaller part of just all of the activity that's happening in that future building, because we're going to have sobering, we're going to have withdrawal management, right? It truly can be, I think, more of that front door that Commissioner Moyer was just talking about. So, so as we're looking at like how we can, bring these updates, or how you can bring the updates forward in the future, I think just having like the deflection plus is probably the what we're going to need to see. And I do think that there needs to continue to be conversation with this board and with the 4002 leadership team on the model that we have for deflection in Multnomah County. We know absolutely that so much because of the law enforcement referral deflection model that we currently have, that we are so dependent on law enforcement, and their ability to engage with people to do the deflection piece is really right now the biggest narrow piece in the funnel for bringing people to deflection. We saw when there were additional folks being assigned to downtown to just be walking around. I think when we had some of the enforcement activity from the federal first showing up, we actually saw an increase in the number of folks being referred because there were just more law enforcement officers doing that kind of work. And we also saw that when the enforcement of some of the camping ordinances happened at the city level, and officers were diverted to do more of that work, we actually saw somewhat of a decrease in that. So it definitely is a big factor in that. And I think as we're looking, with the pilots that we're doing and looking at these other ways of bringing people into deflection, I think we need to realize that there are what is the connections, what is the difference that we're getting in the Pathway Center with the connections being made there versus providers being able to make referrals to random other programs, just in the outreach that they're normally doing. And so what is that value add and the difference with referral to the deflection center and sobering, which I think, again, as we're adding more services and connections there, that's going to grow. So thanks so much for the presentation. We'll look forward to bringing this back. And then obviously there were requests made for some additional data to be delivered to the board. So I would expect that to be followed up on after this. So thanks so much. Appreciate all the work that's happening and all of the good pathways that are being made. All right.
Thanks for having us.
Chair Vega Peterson, would you commit to bringing a plan back to increase usage of the facility?
So the deflection center itself is the use of the deflection center and the deflection referrals that are being made, as I said, are really dependent on law enforcement. So I'm happy to continue the conversations with the mayor, with the law enforcement on how we can maximize those. And that's exactly what the work of the leadership, the 4002 leadership table is about, is how do we make sure that we're flexing those things. So I'm happy to have that conversation with them and bring back the results of that conversation to the board.
Actually, I was looking for more than a plan, and like we just talked about this being the utilization, I mean, whether it's sobering or other things, is more than just a law enforcement response. So, I mean, I would hope we have a plan. We've had a lot of discussions that we're still kind of, it seems like, in the same spot. So I would hope that would be something that we put together, not just more discussions. Thank you.
Thank you. All right, Anthony, were you going to say something?
No, I just said thanks for having us.
Oh, yeah.
Yeah.
Well, appreciate it. And we'll have you back.
Okay.
All right, thank you. Thanks to you both. Now we're going to switch gears and move into our second work session around Preschool for All. So we have different presenters here around the Preschool for All program and our Preschool and Early Learning Division. So I will say that it has been exactly 6 years and 5 days since the Multnomah County Board of Commissioners voted to refer the Preschool for All ballot measure to the ballot. That happened on August 6, 2020. That was really a special moment. It marked the accumulation of 8 years of dedicated work and advocacy by our community, by my office, by the county, so many folks at the county. Ahead of another momentous summer when this board is deliberating on the future of Preschool for All, I want to thank and acknowledge the work that our community has put into this program from before its inception through to today. I think like this is such a program that there is so much ownership of its creation and its implementation by our entire community, and that's really wonderful to see. I said when we were doing the ballot measure referral that there is no community in the country who has written such a comprehensive measure or designed a policy as expansive and in true partnership with marginalized communities in the way that we did. And I still believe that that is true, even now, even 6 years later. So 6 years after the Preschool for All ballot measure passed by a 2-to-1 margin, Preschool for All has proved to be a national model for other counties and jurisdictions to follow. In our first school year in the fall of 2020, Preschool for All enrolled nearly 700 students across 48 different preschool sites. This upcoming school year, just 4 years later, we'll have over 7,000 seats to offer across 363 sites. I am extremely proud of Multnomah County's stewardship of this program on behalf of the families who depend on it, the teachers, the workers, the small businesses who are thriving because of it, and the voters and taxpayers who voted for it and are investing in its success. We must continue to be good stewards as we move into this month, where the board will be considering whether to enact or delay a 0.8% increase in the Preschool for All tax on higher income earners, which is scheduled to take effect on January 1st, 2027. This follows an earlier board action to delay the increase that the board made in 2024. This is the last Preschool for All work session that we have scheduled prior to the contemplation of the work on ordinance changes that will start next Thursday. So today we're going to hear from my policy advisor, Stephen Herrera, DCHS Director Rachel Pearl, and the county's economist, Jeff Renfro, to provide us a brief recap on the PFA milestones to date. We can also hear from, we're also going to hear from the Chief Financial Officer, Eric Ariano, who's going to walk us through a proposed amendment to the county code that will better align PFA's tax collection efforts with the supportive housing service measure efforts. So that is another piece of work for the board to consider that's a little separate from the tax increases. And last but not least, today's work session is an opportunity for other members of the board to present any proposals that you have around this program based on the conversations we've been having in our previous work sessions, as well as some of the scenarios. So with that, I'm going to go ahead and hand it over to our presenters.
Good morning. Thank you, Chair. For the record, can you hear me? Perfect. My name is Stephen Herrera. I'm a policy advisor in the chair's office, and I use he, him pronouns. As the chair mentioned, my colleagues are here virtually today. Rachel Pearl, interim director for DCHS, Jeff Renfro, the county's economist, Denisa McLean, preschool and early learning director, and Eric Ariano, the county's chief financial officer. Next slide, please. So thank you. So today, I know there's not a lot of time for us. We only have 45 minutes, so I'm going to try to drive through this agenda of our recap of all the milestones we've hit and how we've got here to date. I'll recap our PFA milestones to date. Then Eric Ariano, our Chief Financial Officer, will walk us through his proposed tax collection changes. And then I'll hand it back over to the chair, and she'll walk us through her proposed ordinance around the 2-year delay. Next slide, please. So in April of 2025, we convened 2 limited terms. Well, in April 2025, we actually convened the TAG, and a few months later, we convened the PAG, the Technical Advisory Group and the Program Advisory Group. And these groups' charge were to specifically evaluate the long-term sustainability of the Preschool for All mechanism and develop a set of policy recommendations for the board. The TAG focused mainly on fiscal sustainability and evaluated some tax policy scenarios, and the PAG focused on program impacts on cost and access and quality. Next slide, please. During that time, we also opened a procurement process and were able to hire Laura Media to conduct our community engagement process to inform the PAG and the TAG and the board's work. And that community engagement effort yielded we heard from about 2,000 community members who completed the survey and about 84 folks who participated in focus groups. Some of those findings, here are some of the findings. One was universal preschool as a public good. So PFA is a moral and economic investment that strengthens families, lowers long-term social costs, and builds community resistance. Another finding was equity and inclusion. The culturally specific programs, building access and outreach to immigrant and underrepresented communities are essential. And trust and transparency. More frequent, transparent communication on enrollment, funding, and program decisions is needed to rebuild public trust. We also found that there were benefits to the workforce and quality of that. So living wages, it allowed teachers to have living wages and early childhood educators in the program to have living wages, provided professional development opportunities, and culturally responsive training that are vital to the quality of educator retention and sustainability. And finally, funding and accountability. Strong public support for progressive taxation exists, but fairness in the tax structure, diversified revenue sources, and transparent fiscal reporting are crucial for sustainability. Next slide, please. So fast forward to April of this year, the TAG put forth its set of recommendations, which we presented to the board. And those recommendations were to commission a preschool cost study or a true cost of care study, commission a demographic forecasting model. They recommended also to delay the Schedule 0.8% tax increase, establish a rainy day fund, and stay focused on universality. Next slide, please. So from April on, as I mentioned, we delivered the TAG and the PAG's recommendations. The board requested some additional PFA tax scenarios and modeling requests. Sorry, I can't find my words today. And also, Commissioner Moyer put forth a resolution to commission a true cost of care study. In May, we set a deadline for additional PFA tax scenarios and modeling requests from the board. Commissioner Brent Edwards also put forward a resolution to commission a gap analysis. And in July, we had the true cost of care briefing and our first PFA work session where our economist Jeff Renfro walked us through the economic scenarios that were requested from the board. Next slide, please. And next slide. I forgot to say it. I had my all set. Okay, sorry about that. Thank you, Tasia. And so now I'll just invite Jeff Renfro up to walk us through his modeling request from the board that he did in our earlier PFA work session. Tasia, that should be the second deck that I attached, or you can just click the link and it'll bring up that presentation.
Thank you, Stephen. For the record, I'm Jeff Renfro, he, him pronouns from the budget office. I'm going to be pretty brief. I'm just going to do a quick reminder of the same set of slides that we went through a few weeks ago that Stephen referenced. If we could go to the next slide, please, Tasia. And one more. So to start with, this is what we call the updated baseline estimate. So the only change we made in this scenario is we updated the population estimates based on the preliminary new demographic forecast that Portland State's Population Research Center had provided to us. So this takes the assumed number of seats provided at Universal from 11,200 to just a little bit above 8,000. As we talked about in the past, the number of seats are really what drive the expense side. So this improves the expected fund balance as we go through program implementation. And this graph shows the fund balance bottoming out well above zero in this specific scenario. This, just as a reminder, this scenario also assumes that the tax is increased by 0.8% on January 1st, as it currently says in the code. If we want to go to the next slide, please. So this scenario looks at what the TAG recommended. So it includes the updated population estimates. It assumes a 2-year delay in the tax increase. And then it also incorporates the updated seat costs from the true cost of care study. So due to the increase in the seat cost assumption and then the delay in the tax, we see the fund balance dipping below where it was in that baseline, but still bottoming out at about $250 million. I think the last time we talked about this, there was some question about what's kind of an appropriate gap, or how far above zero do we have to be where we all feel comfortable. And in my mind, you know, when we're running through scenarios or we're changing assumptions in the modeling, you know, small changes over a long period of time can lead to big total dollar amount changes. And so this scenario, even if we're doing like the little bit of tinkering that we tend to do in between years as we're kind of updating all of our assumptions, I would still expect that kind of normal amount of inter-year variation, that this scenario would still stay above zero as we make those little adjustments. So in my mind, if we think that even with those like small changes that we might make from time to time, it would still the fund balance line would still remain above zero. That would be my definition of what is comfortably above the zero axis. If we could go to the next slide, please. So the next two are two modeling requests from Commissioner Moyer. This was just a reminder about how increases in the reserve amount are incorporated into the model. So as we top up the reserve to a new policy level, that's included as an expense in the modeling. And then when we incorporate a recession on the revenue side, we're including a whole business cycle. So we have the initial drop in revenues, but then we have a recovery and then going back to trend. If we could go to the next slide, please. So the first scenario that Commissioner Moyer requested, it includes updated population estimates. It includes the updated seat costs from the true cost of care study. It assumes a 90% participation rate rather than the 77.5 we're currently assuming. It assumes that we don't lose 10% of kids who are born in the community before they get to preschool. This is the like generally, you know, growing families, some of them leaving for the suburbs to, you know, buy a cheaper house with a yard. It assumes that we ramp up our professional development costs, we increase the funding for the subpool, and then we double the inclusion cost assumptions. It also assumes that we set the reserves at 1 year of operating costs, and then there's also a Great Recession level recession next year. As you can see, when we incorporate the changes to both the revenues and the expenses, our fund balance dips well below zero. So given all of these assumptions, we wouldn't have the resources to fully fund the program at this level. Next slide, please. This is a variation on that same one. So it's all of the same assumptions, except it assumes that the level of reserve is set at 2 years of operating costs. So that's an even more significant increase in expenses as it's first implemented. So the fund balance goes even farther below zero in this case. Next slide, please. And then finally, this is a request from Commissioner Singleton. So this one includes the updated population estimates, the updated seat costs from the true cost of care. It assumes that we start indexing without any rebasing. So it starts at the current threshold level and just goes from there. And then also assumes that we incorporate cost share for families above self-sufficiency. So families above a specific level of income would have to pay for the difference between the 6-hour and the 10-hour day. As we talked about last time, there are a lot of different ways we could imagine including this. The way that's currently modeled here, based on feedback and collaboration with the PFA team, assumes 15 FTE would need to be implemented. So it leads to a net increase in revenues of about $6 million per year. In this case, the fund balance line in the baseline case, as well as in the low population estimate, stays comfortably above 0. Next slide, please. Okay, so that was a very quick reminder. I'd be happy to answer any questions if people have them.
Thanks for walking through those again, Jeff. I'll just open it up and so it looks like Commissioner Moyer has her hand up. Anyone else can just put their hand up if you have questions for Jeff. All right, Commissioner Moyer.
Yeah, this is a follow-up, but I was hoping maybe getting, you know how I asked for various scenarios? Instead of layering them all on top of each other, showing each one versus status quo, if that's possible as a follow-up, that would be really helpful.
Yeah, we can, I can work on that.
Thank you. As far as your current projections looking forward over the next 3 years, what level of confidence do you have that we are unlikely to see major variation, mainly obviously downward from what you projected? I mean, I'm not an expert at how unstable things are, how confident economists are feeling. So I'm just curious. Right now, it seems like a pretty high degree of confidence that we could prolong for a couple of years this tax cut and safely operate.
Yeah,
I just want to know how confident that confidence is.
I would agree with that assessment that it seems like we could comfortably delay the tax increase by 2 years, given our assumptions here. I would say that, you know, with this tax forever, like it's going to be extremely volatile. And I would say at this point, we've tried to be kind of like right in the middle. So I think the likelihood that, you know, capital gains related income would either spike or dip below our assumptions are probably equally likely. So I expect to be surprised by some aspects of this revenue all the time, basically forever. But I think, like I said, I think we're trying to balance the risks, so we're just as likely to be under as we are to be over at this point. And I think even if you know, we started to see like a move towards like sort of national recessionary environment right now, it would take a little bit for that to get to show up in our tax returns. So you know, we would need something to significantly change at the macroeconomic level pretty soon in order for us to get more nervous about that 2-year window.
Okay, thank you so much.
Thank you, Commissioner Moyer. Commissioner Singleton.
Thank you, Chair. I don't know that it's going to make a ton of sense. So Jeff, I'll defer to you. But I've been feeling inclined. I am likely going to bring forward an amendment when we get to this resolution to revisit the tax increase in 1 year. I don't feel totally set on inclusion supports in particular. And I know there's a lot of work happening now, but I'm not sure that we can estimate the cost of that. So I don't necessarily, unless you think it makes sense to go model a 1 year delay instead, it just doesn't look like it'll significantly change anything on the graphs from what I can see.
That's right. So it'll just make it so that we expect when the tax does increase to generate about $50 million of additional revenue. So if you think about the fund balance line, a 1-year increase, it would mean over the course of kind of that whole period, we'd have an extra $50 million and kind of spread out over such a long period. It wouldn't make a huge difference, but I'd be happy to do it if you think it would be helpful.
That suffices for me. So please don't feel like you need to go run that. But just so my colleagues are aware that that's my intention with this. I know that the recommendation coming out of the TAG was 2 years, and I understand that to be a compromise, but I just don't quite feel set on some of the inclusion pieces that I know we're still exploring and piloting. So I'll be bringing forward something to revisit the tax increase in 1 year.
Okay, thank you, Commissioner. Any other questions for Jeff? Commissioner Brim-Edwards.
Yes, thanks for the presentation. I couldn't tell from the presentation, do you have the final demographic or population estimate report from PSU or wherever we're getting it? I know it was draft last time.
Yeah, I was told by Denisa this morning we're going to get it today.
Okay, great. As soon as you get that, I'd be very interested. Obviously, this is an issue that I raised almost 2 years ago, I think. So I'd be interested in sort of the new projections that we're operating under. I'm also going to be interested, and thanks for agreeing to produce the slide that Commissioner Moyer asked for, because when I look at the scenarios, it's sort of like, oh, we'd be really having a really bad year if all those things came back, like everything happened at once, or like kind of the worst case scenarios all pancaked on top of each other. I mean, obviously it could happen, but I think a more likely scenario is some may happen and there may be some increases, but other ones won't. So I would be interested, just because I think it will give us a more nuanced look at the probabilities. So thanks for agreeing to provide that. And the other thing is, I just want to so I have this clear, the dollar amount that is a 1 year reserved is how much to actually operate the program?
Right now, 1 year reserve is 15% of expected revenues, which I think is like 28 million right now. Anyone on the PFA team wants to agree with me or not, but I'm at least close.
28 million. So when you have on the projections for the 2 year reserved, you're then building into like $56 million of a 2 year reserve, or am I doing the math wrong?
The 2 year reserve, it's 2 years of operating expenses. So in that scenario, the reserve goes all the way up to it's above $700 million. It might be 750, something like that. So it's a really significant increase. So the 1 year reserve, I think in the first year goes up to about 350 million.
Okay, I'm sorry. Can you what is the 28 million? That's not really the reserve?
That's what our reserve policy is right now.
Is currently. Okay, I'm sorry.
Yeah.
What I meant to ask was the other question, which is like, what actually say if we had no money coming in, what is that amount to operate for 1 year?
Yeah, I believe it's $350 million in the first year. I can give you an exact number, follow up with an exact number, but I'm close there.
Okay. And I think last time I raised this again, and I'd appreciate if you're getting it, is like, we're not going to have a year where there's no money coming in. I mean, just like, that's not going to happen. And I think I ask about this sort of like, what more realistic. So in a great recession means we'd have X amount coming in. And so really it's the amount of reserves needed would be the delta between the Great Recession income, it's not zero, and the 350 million. So I'm curious what that is, because I think that's a truer measure of like what the actual reserve is, not that we're there's no scenario where we'd get zero income coming in. And that's I don't need it at this meeting. You can just send it to me or send it to all of us.
Sure, I can do that.
Great, thank you. Do you have any prediction? I guess last question, like, are there signs that we're heading towards a Great Recession based on the economic indicators?
Locally, like there continues to be some worrying employment trends. But also I think we kind of constantly have to correct our thinking about this because this tax is specifically on higher income people. Some of that employment softness just kind of isn't happening at that level. And then even during periods of like the Great Recession, people with a college degree, I believe the unemployment rate popped out at 5.5%. So we would expect this group of payers to be a little bit more resilient in how much they pay us during those periods. And then also just because 20% or more of the income every year comes from capital gains, the stock market seems like it's doing pretty well right now. So no, I wouldn't expect anything in the next little bit to have a negative impact on our revenues.
So, and we'll see this when you do the more nuanced set of projections, but like, then what, because it sounds like what I heard you saying is like, even if there is a Great Recession, that the impact on the revenue is, you're not suggesting that there'd be a large impact. So is that what we'd see in this more nuanced piece, is like there actually a Great Recession would not likely have a big impact on the programs?
No, I would say it would. So if we had like a Great Recession level event, I think we would lose about 40% of our revenue year over year. So that would be significant. I think the point that I was trying to make is that even locally, when you look at some of the like not great kind of economic news and data, that type of like looking at employment trends, that if we were thinking about recession at a national level or a broader level, like employment trends is what we would be really focused on. And just because we have a smaller subset of people paying this tax, the connection between like employment rates and then economic weakness, or the type of economic weakness that would affect our collections, is like a little bit weaker than it would be for the broader economy.
So it'd be other economic indicators that would be more indicative of whether or not we'd see that 40% reduction.
Yeah, so I'd be looking at things like corporate profits or stock market returns or asset prices, things like that, as well as employment. That would be one part of it, but it's just not quite as important a piece of it.
Great, thank you.
Commissioner Jones Dixon, did you have any questions for Jeff?
No additional questions.
Okay.
Thank you.
All right. So appreciate the conversation. Thank you, Jeff, for this. I think there's been a couple different asks around different scenarios. Would it be helpful for you, Jeff, to get those in writing from folks?
That would be great. I think I got them, but if your chiefs of staff want to email it to me just to make sure I get all of the nuance, that would be helpful.
Okay, great. One of the things that I would love to see is if we did increase the inclusion costs, what that does to the model, like, just based on, because I do think that's an important piece of work that the division is in the midst of right now, along with the true cost of care information we're going to be getting. So if we were to increase that significantly, like what does that do to the modeling? And then, yeah, so I think that's the one that I'm interested in that we haven't seen. I don't believe we've seen it. Okay.
Yeah, and I'll interpret significantly as like doubling it. Maybe does that sound what you're looking for, or you can provide more feedback on kind of the magnitude when we follow up.
Doubling is probably good. I would want to check in with Denisa, in terms of what, like, based on what is currently being contemplated as increased, does that make sound reasonable? So Jeff, we'll definitely follow up with more specifics on that. I do think the question of whether to do it in a year or to do it in 2 years is going to be an important one, just because we want to make sure that obviously we have the revenue needed for the program to move forward and not be in a situation where we can't implement a needed change because we are concerned about revenue impact. So I think that's really important. And I also know that there is something to be said for the predictability and stability of having kind of an understanding of what's going to be happening with the tax rate a year or 2 years out. And so being able to communicate that clearly is going to be good too. Okay. Thank you so much, Jeff. So we'll look forward to, I think when we move forward with the ordinance work, we'll definitely start with a review of all the scenarios for it, so that we can have that as part of our discussion there. Thank you. Okay. All right, Stephen, where are we going next?
Great. So slide 9, please, Tasia. Can you pull that up? So I'll just talk through that slide while it's coming up. So it's the last slide before I introduce Eric. So it's all the milestones that are coming to date. So as Jeff mentioned earlier, we're going to be having the updated demographics survey that's going to be due to us any day. Also, you should have received the draft copy of the True Cost of Care study, each one of your offices. And so all of this work is going to inform 2 board votes that have to happen before August 31st, which is the deadline to make any tax changes for next year. So after today, we'll see each other again on August 20th, and then again for a second vote on August 27th. In September is when those code changes will be disseminated, and we'll get to work with operationalizing those code enhancements. So that's the timeline and milestones to date. Now I'll just hand it over to, next slide, please, Tasia, to Eric Ariano to walk us through his tax collection changes that he wants to discuss with you all.
Yeah, thank you, Stephen. And for the record, Eric Ariano, Chief Financial Officer and board chair and board. I just want to quickly pivot to this, and then we can pivot back. I'm going to come to the board on similar timeline on the 20th of the month and the 27th of the month for a second reading to request changes to our preschool for all tax code, specifically to section 11542, which deals with refunds and deficiencies. And the proposed change allows us to make some modifications that allow us to provide potential refunds to taxpayers that may have overpaid through employment withholding, specifically for tax year 2021 and tax year 2022. And just for some context, is under our existing county code for preschool for all, is that we require that taxpayers file a return 3 years from the due date of the tax to be eligible for refunds. And this is in alignment with Oregon by statute, specifically chapter 316, the state of Oregon. And we also obviously align with our partners over at Metro with the supportive housing services tax. And again, that provision is really meant to make sure that individual taxpayers are filing timely, but also paying timely as well. So again, that provision requires that taxpayers file pay and file within 3 years of the due date to be eligible for a refund. So the city of Portland came to Multnomah County and to Metro a few months ago to let us know that for tax year 2021 and 22, and more specifically for tax year 2022, is that they had identified a significant number of the taxpayers that through employer withholding, and employer withholding is just an employer with the employee identifies a certain amount that gets withheld on a, on a cadence, whatever cadence they have to pay their employees. And then that withholding is remitted to the city of Portland for each individual tax program. And so what the city identified is that there was some taxpayers that had that withholding that never filed for those tax years. They never filed, but we had a payment from them that may have overpaid. And so considering the fact that in the early years of the tax, just with people being introduced to the tax, knowing the tax code, knowing who to pay, how to pay, and just even Multnomah County, some of the things that we did around trying to enhance communication, that it makes a whole lot of sense that we acknowledge that for those tax years that we do some outreach to those taxpayers and give a little bit more time for them to file and then potentially get a refund if they're eligible. Because we think they're potentially, some are eligible for refunds, some may not, but we want to give that space. So under the proposed modification to that section of the code, we'd give kind of a temporary grace period, where if the taxpayer for those specific tax years, 2021 and 22, if they file a return by April 15th of 2027, for those tax years, and then request a refund, they would be eligible for the refund just in that and for that time frame. And if they make those two steps, they'd be eligible. And so if the board were to approve these this code changes, again, then I'm bringing on the 20th and the 27th, is that we would quickly pivot and do a City of Portland would coordinate a campaign to reach out to those individual taxpayers that potentially could be eligible for a refund for Preschool for All. So this the other reason for this change is just that obviously I mentioned that our partners over at Metro have a similar issue. And so their council approved a code amendment to the supportive housing measure, I think back in May, to adopt this change. And now we're bringing this forward for Multnomah County for Preschool for All. So that is the proposed change. And again, I will come to the board back on August 20th and 27th for first and a second reading, more specifically to this request. And so I'll just leave it there for any questions or comments, but if not, we'll pivot back to Stephen.
Thank you, Eric. That concludes the presentation. We'll open it up for more discussion. I'll give it back to the chair.
Yeah, thank you, Stephen. Any questions for Eric? If folks want to just raise their hands on what he just described in terms of the changes needed for the ordinance. I don't see any. Okay, Tasia, would you mind taking on the slides then so we can move into the discussion part of this? Okay. Great. Okay. So we can open up for discussion. I think I will just start off. My plan is to bring a proposal to delay the tax increase for 2 years. I want to make clear that this is not I would never bring forward something for a vote that I felt undermined this program that I helped create, champion, and implement. I will say that Preschool for All is one of my really proudest achievements in my career in public service. And I really want to respect all the work that has gone into this program, and especially the work by the PAG and the TAG. So I think the proposal to delay the tax makes sense. I think it protects the program by ensuring we are being fiscally responsible and ensures we continue to meet our goal of providing high quality, joyful preschool for every child in Multnomah County, all the while preserving the option to raise the tax in the future if the economic forecast changes. So the board always has that option. The proposal for 2 years really takes into a couple different factors. One is that the majority of the TAG members made a series of recommendations to the board, including delaying the scheduled tax increase until 2029, preserving the option to revisit if the tax increase is needed at any time. And I really agree with that kind of philosophy in terms of how to handle both predictability, but also the board's ability to continue to be responsive. And really, there's been a lot of work done to analyze the budgetary needs of the program and future revenue projections, as we've heard a little bit about that today from Jeff. while we continue to digest the new cost of care study, the updated demographic report, right? All of these things that are important factors. And I think the thing that's been true from the beginning is that the bottom line is that it's the primary cost driver for Preschool for All is the number of seats that are going to be allocated. And we know that an updated demographic report, which sounds like it's going to be imminently arriving in our inboxes, will show that we need approximately 3,000 fewer preschool seats to reach universal coverage than what the baseline assumptions of the program started with back in 2019. So I'm really interested in seeing the impact of on that. But I also am really interested in what it would look like to increase inclusion expenditures and making sure that there is capacity to do that kind of work, even with a 2-year delay. So that I will go on the record of saying that that's something that I'm very interested in seeing in terms of the data and what this board's action would be. So I do believe that the board's commitment, our commitment to the public, is that we can continue the program's growth for future generations. And I think a 2-year delay allows us to do that. And we can afford to do that with the 2-year delay. So I want to just, again, share my gratitude for the work of all of the volunteers who served on our advisory committees, who helped with the recommendations and to the point we are today. The community members who have voiced their support for the program, and this board for your interest in championing this program. Any decision that we make ultimately around this really is that impacts the future of this program has to be guided on the research, data, and a community-centered and equity-driven process. So I want to thank Jeff for all your help with helping us get this data that we need, and also Denisa and Rachel for your leadership in helping answer all the questions that we've had for this. Stephen, thank you so much for all your work in shepherding this. So just really appreciate that. And again, look forward to the continued discussions when we come back to this in a couple of weeks. All right. Any other questions, comments, discussions? Okay. We are at the top of the hour. So thank you again, everyone, for all the great work today. Lots of topics we covered today, but really all really important issues for the county. That concludes today's board briefing. Our next meeting is scheduled for Thursday, August 13th at 9:30 a.m. There being no further business, we are adjourned.